administration vowed that any American can now be tested for the virus if a doctor deems it necessary. Joining us now for the latest is healthcare analyst Seth Denson. Seth, thanks for being with us again. So the question is, if someone's feeling as though they might have contracted the coronavirus, can they go to the doctor and request a test? And then my second question is, are there enough tests to actually test these patients?
Well, I mean, you can request a test. Now, I don't know that you'll get it. Doctors are following CDC guidelines very closely to ensure that those that are receiving actual coronavirus tests are those that are showing actual symptoms of the illness. And so, you know, physicians, practitioners, they're well versed in what's going on here, and they're following those guidelines specifically. I think for the average American, it is, if you do start showing signs of illness, contact your provider. Engage with your doctor and your local providers to make sure that you're following their course of action. And then most of all, maybe don't go to the mall or start going out and doing a whole bunch of stuff. Try to do what you would normally do if you're sick and stay home.
Okay. Meantime, the WHO warned of a global shortage of medical equipment to fight the virus. So, Seth, do you think hospitals are prepared for the potential surge of patients infected with the disease?
Yeah, I think the U.S. hospitals are well prepared for this as well as they can be. And we're actually hearing from the U.S. government, the Treasury Department's working with HHS to make sure that more masks are being ordered and produced right here in the United States. More testing kits are getting out, spread out throughout the United States for practitioners to have access to. So I think, listen, we are still in a phase of not really knowing what tomorrow might bring with this illness, but the U.S. healthcare system is well prepared for it if and when something arises.
And can you kind of explain what this test might look like? Is it any different than testing for the flu?
Well, actually, I don't know that I could speak to that. I haven't really dove into the specifics of this test. My assumption is it's somewhat similar. A swab is what I've understood it to be. It's a swab that they're going to be able to test through microscopic structures as they do any other type of illness.
Okay. In the meantime, at least here in New York City, the city has bleached almost all of its subways to disinfect the potential virus. Is this effective at all?
Well, sure. I mean, listen, I would argue that we probably should be bleaching some things regularly that maybe don't get bleached enough as it is. And so, yeah, I think that things like your normal protocols of cleaning surfaces, whether that be through Lysol, bleach, and some other things, is appropriate. Again, I want to also caution people, though, and I think the CDC has done this, is that don't overly maybe disinfect, and we're seeing this panic. My wife actually called me the other day from the grocery store just to get normal household goods. They're gone. It's hard to find them on the shelves these days. And I think that's the sheer panic of the American citizen right now. So maybe take a step back and recognize that our normal protocols are necessary, but don't go overboard.
And again, of course, the final advice that you would have for anyone fearing they might contract the virus?
Yeah, wash your hands. Follow the normal protocols you would when you're not feeling well, right? Don't sneeze into your hands and then touch a bunch of surfaces. Don't touch your face. Don't do those types of things. Contact your local providers, your doctor, and seek counsel.
All right, some great advice there. It's Seth Denson. He is a healthcare analyst and author of The Cure. Thanks for joining us.